So we are attempting to answer to the question, cancer prevention. Is it possible? For us to say yes, we must know the risk factors, because the risk factors are very important to know so that you can delay or prevent the development of the cancer. I mentioned earlier the risk factors of developing cancer on female. But I didn't have enough time to elaborate on the risk factors of developing cancer on male. But I went in and I found 13 risk factors generally that can predispose us to developing cancer. We mentioned age. Age is a factor. We all have to die one day. And we all have to get old one day. And the process of getting old can be very painful. Cancer of prostate, you don't develop until you're in your 40s, 50s. So most of the cancer, lung cancers, you don't develop until you're in your 50s. Colon cancer, you don't develop until you're in your 50s, 60s. Right? So diabetes type 2, you don't develop until you're in your 40s, 50s. While getting old can be painful, can increase the risk of developing cancer, but if we have lived a good life, if we had led a good lifestyle, we will go through the 50s, through the 40s, 50s, and 60s healthy. I have a story to tell you. An 83-year-old man came to KPH. It was like 9:45, and I'm just about to finish my shift. So I said, okay, I'm going to call somebody and quickly see the patient. I look at the docket, 83 or 85 male. Came to the hospital for dizziness. When I look at the blood pressure was 100/60. I look at his temperature was normal. His heart rate normal. Blood pressure of 100/60, that's like a teenage blood pressure. I said, well, because it's 83 or 85, I hope he didn't have any stroke or he didn't have any catheter. When I called the name, in less than a minute, the man came knocking at the door. I am here, I am here. I said, oh. He had a puzzle in his hand. Slim. Like 5'5", the height. 5 feet, 5 inches. Put his shirt under his pant, belt. Cut his hair, no beard. Okay, interesting. I said, sit down, Mr. Peter. How are you? I said, Doc, I am fine. I just came because I got dizzy at work. What blew my mind, while I was talking, the 83, 85 years old, his phone rang. WhatsApp dial tone. I said, Peter, you use WhatsApp? He said, wait a minute, Doc. I use WhatsApp. And then the granddaughter told me, Grandpa, why you there? Why you there? I said, no man, I'm at the doctor's office. Give me some 5 minutes. The granddaughter was driving at Crossroad to come to KPA to pick up the grandpa on WhatsApp. 85 years old on WhatsApp. So I got very curious about, Peter, hold on. You're using WhatsApp and you're 85 years old. What do you do? He said, I work. Where do you work? He gave me the name of the firm. He is a certified accountant. His job sent him to retirement at 61. They called him when he was 69. They sent him again when he was 73. They called him back when he was 78. Because the job Peter used to do, they hired 3 university graduates and couldn't do half of the job. I said, but Peter, this is interesting. Do you have children? He said, yes, I have 4. All are girls. I said, you're married? I said, no, Doc, I divorced a long time. I said, oh, Peter, I can see why you live so long. We laugh it out. He said, Doc, I raised my 4 girls alone. I sent them to school. So I was about to ask Peter his religion. I said, well, I'm going to ask Peter, do you go to church? He said, of course I go to church. I said, which day of the week do you go to church? Sabbath. Peter goes to Olympic Seventh-day Adventist Church. I said, oh my Peter, I'm 56 years old. Peter, when I get old, I want to be like you. Some people are in their 50s, they can't even open a laptop. They can't even have a WhatsApp. You better get one because it's what we're using now to communicate. I came in Jamaica when you used to make line to go to make collect call in US. You remember those days? And you make a collect call. Line. We don't need that now. Communication has become so easy. 85 years old. Vital signs of a teenager. And I say, Peter, tell me now, how much do you food you eat? Peter eats twice a day. Peter wakes up at 5 o'clock every day. Peter spends 30 minutes exercising in his house every day. Result, 85, healthy, no bag, no stroke, nothing. Peter can drive. He came to the hospital for dizziness alone. Nobody taking him all over the place. Can we prevent cancer? Yes. Is cancer preventable? I will say yes. Just on topic number 1, where we are talking about the risk factors. Aging is one. But we can age gracefully and we can age with health. Risk factor number 2 for cancer, alcohol. Excessive use of alcohol can lead to what? Cancer of liver. Every patient that have treated, diagnosed, admitted with the cancer of liver, they have consumed alcohol. Another lifestyle disease that can lead to cancer of liver is what? Hepatitis B and hepatitis C. One is sexually transmitted and the other one is what? Bad hygiene. Eating food without washing your hands. Eating food on the street without knowing how the food was prepared. The hygiene surrounding the preparation of the food. Hepatitis can lead to cancer of liver. Diet can also lead to liver. And we know a lot about diet. But let me tell you, we have to revisit the diet. Today, in the 21st century, the problem is not between the meat and the vegetable. We all know meat is bad. We all know meat is responsible for many diseases. But today, in the 21st century, flour is as bad as anything else. Rice is as bad as anything else. Sugar, in fact, cancers feed upon sugar. Bun, syrup. I have sweet tooth. The problem is not only meat now. The problem is white, flour, sugar, rice, highly processed food items. They are not good for your health. If you discontinue or decrease the consumption of those items, you are indeed preventing or delaying the onset of cancer on your body. Chronic inflammation. Pasta, rice, white bread, white sugar, soda, all these build up inflammation in the body. Some type of oil we cook with rise the inflammation. And inflammation is also one of the risk factors for developing what? Cancer. Hormones therapy. As I said earlier, hormones therapy will also lead to the development of cancer. Some infections will also lead to the development of cancer. Listen to this now. Obesity. If you think being fat is cute and sexy, no, it is not. Obesity is responsible for 20% of all the cancers. And I was counting last night, my number reached to 145 types of cancers. So if you are obese, you are inviting how much? 20% of 150. You are inviting 30 cancers in your body. I saw few ladies slim with breast cancer, but 80% of ladies with breast cancer are overweight. Their breasts are big. Radiation, x-rays, film, before the computer, going to the immigration check. All these, too much, can lead to the development of cancer. Sunlight. Can we talk about dressing? Hi, anybody in the house? The type of dressing, to go to church or to go to the beach or to go to school or to go to work. Too much exposure of sunlight on the skin can lead to the development of cancer. Cigarette smoking can lead to numerous cancers in the body, but the most prevalent is the throat or the chest, the cancer in the lungs. This one again, when I ask everybody when they come they cannot breathe and they cough, they need oxygen, I say, young man or sir, have you ever smoked in your life? 99.9 they will tell you, yes, we had smoked. 1% of those who have not smoked, they will tell me, I did not smoke, but my husband was a heavy smoker. Do not take it for joke when you're among smokers. Run them out of your place. Tell them to go and smoke outside. Second-hand smoking is as bad as the first-hand smoking. So now that we know about the risk factors of developing cancer, And when we reduce those risk factors, what we are doing is reducing the probability to develop cancer. What are the symptoms? Depend on the organ. If it is in the throat, you may cough blood, or in the lungs. If you have the paranasal cancer, you may not smell, and you may not smell well. And when we look, we can see a mass, or we send you to do a CT scan, we can see a mass somewhere there. Cancer in the lung, you will have difficulty breathing. Cancer in the cervix, you will have bloody discharge or unusual discharge. And when we do the pap smear will tell us that changes already what? Are occurring. Cancer in the skin, you have some spot on the skin, change of color. Cancer in the colon, you can have blood or constipation. Cancer in the prostate, you can pass blood in the urine or difficulty urinating. Cancer in the bladder, you can also pass blood in the urine. Right? So depending, cancer in the breast, you're going to have a mass. Right? But this is not a mass that moved, a firm mass. When we examine the mass, you can see the mass is rooted in the breast. And on top, there's a change of the complexion of the skin in the area where the cancer is. And they come late and they ask, why do you come now? I was watching it. So, the symptoms will depend where the cancer is. In the kidney, pain. In the gallbladder, pain. Cancer in the eye, there may be a swelling. Cancer in the back of the eye, retinoblastoma, it affects the vision. So it depends where the cancer is located, and the signs and symptoms will come right there.